This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, everyone. This is Heiko from Acupuncture On Air, where we're interviewing acupuncturists from around the world, and in particular we're continuing our series of interviews with our special guest from the UK, Dr. Carolyn Eddleston. Good morning, Carolyn. How are you?
Good morning. Actually, it's good evening here.
That's right, yeah. Because
thank you.
It must be pretty late over there and cold, I presume.
It is a bit. We should be heading into spring, but it's taking its time.
So listen, today we're going to be talking about a common complaint. I mean, it's experienced by, I couldn't tell you how many millions of women around the world, and that is heat flashes, or sometimes called a heat flush, as a result of menopause. Now, Carolyn, I know that in Australia and New Zealand, many women seek acupuncture and Chinese medicine, particularly for fertility, and I presume it's the same in the UK. But what about menopause? Are women becoming aware that there are treatments available using acupuncture and say Chinese herbs for heat flashes? And do you have many women with this sort of complaint coming into the clinic for you in the UK?
Yeah, I'd say there's been a big change in the last 2 years, and I don't know about New Zealand and Australia, but in the UK we've had a huge celebrity media push with a couple of celebrities over here really beginning to talk about the menopause, and there's a big push for menopause awareness in corporate organisations. So it suddenly had a lot of media coverage, and I think that brought people to acupuncturists and herbalists more than they did in the past.
Okay, great. Because we know from Western medicine, that menopause, if you read it and say it's basically due to declining estrogen levels secreted by the ovaries, and that's black and white. That's what causes the fundamental thing to happen. But the causes of the actual heat flush, and what's always intrigued me in most cases is that after some years the heat flushes stop, but yet the estrogen levels are still low or stay low. Are you able to tell us from a Western medical point of view, why do they actually stop?
Yeah, I wish there was a simple answer to that, Heiko. So it's interesting. If you think about it, when they've measured estrogen levels in women who are perimenopausal, around the menopause, post-menopause, there's a huge variation. Even though the trend is that it comes down, there's a huge variation in the levels circulating in the body. And it doesn't have much correlation with hot flushes. What I mean by that is there are women with exceedingly low estrogen levels with no hot flushes, and women with higher levels with terrible hot flushes. And if you think about it, prepubescent girls who haven't started their periods and menstrual cycles have got low estrogen. They don't have hot flushes. So I think there's more to it. And I don't think they really know the full story, to be honest.
Okay. And you and I both know that, in Chinese medicine diagnostics, there may be a few different cases, how we look at heat flushes. For example, it could be, we say that, the kidney yin is weak, or, the left kidney is weak, or the liver has too much heat, there's fire which rises up, causes the flashes. But of course, and we know that acupuncture helps, but of course, acupuncture is not actually increasing the estrogen or turning back the clock. So this may sort of tie in with the other reason, because they don't really know what happens in Western medicine, why they get their flushes. But I guess, in acupuncture terms, what do you think is happening?
Well, it's interesting because when they've looked at hormone levels in fertility treatments with acupuncture, they can increase estrogen and they can change hormone levels. But of course, as you say, if the ovaries aren't producing estrogen, you can't turn around back the clock. You're right. But of course, with acupuncture, if we look at it in fairly simplistic terms, what we're doing is correcting imbalances, aren't we? If there's too much heat, we're trying to reduce it. if there's too much cold, we're trying to increase the warmth. There's this balancing and trying to correct an imbalance. And I think that the other thing is it's individualized. So 5 women with hot flushes would all get a different treatment, wouldn't they, according to the cause?
Yeah.
And of course, in Western medicine, it's one size fits all. So I think that's the biggest difference with Chinese medicine is you're looking at the individual, and it could be several causes for different hot flushes, and you're treating the cause, not the symptom.
That's right. Now, modern medicine, will tell us that stress can cause heat flushes. Well, actually, modern medicine can pretty well tell you that stress causes everything or complicates everything. But many women have told me that leading up to menopause, they could have a certain level of stressful things happening at work or at home, and they were fine. But then once they sort of get to that age or that level of lower estrogen, if you like, and then when they get overwhelmed at work, or even if they don't feel particularly stressed, but they're just busy in their minds, it seems to trigger a heat flash. But before they could have just gone through it and coped. Now, as we know, acupuncture has been known, and I think in many sort of research aspects, it's been shown that it can treat stress, and many patients, whether you're treating menopause or tennis elbow or whatever, they just say that with acupuncture, overall and generally, they just feel more calm and in more control of their thoughts just having acupuncture. It's a bit like getting a massage, you feel better for it. Yeah. Do you think it could just be as simple as that? The acupuncture is generally just de-stressing the patient, and then somehow they can help with the heat flushes?
I think there'll always be a general side effect of acupuncture that calms the nervous system, increases endorphins. They've done some experiments where if you stick needles anywhere in the body, you'll have a sort of general effect, which unfortunately is why you could be an appalling acupuncturist and have some effect, which is awful to say. Thank goodness we have regulation. But what they have shown is when you do specific points and they've scanned the brain, you can see certain areas of the brain light up. So I think there's a general anti-stress relaxation effect. But I think you can be much more specific. As you know, if you use certain needles, you have a better effect on hot flushes, don't you?
Yeah. Now, one of the questions that women always ask, and how long will it take, and how many sessions, and will it last if I stop the acupuncture? And I usually respond with a sort of that type of question is, well, how long is a piece of string? Like, how long have you been getting the flushes? 1 year, 5 years? How severe are they? Day and night, only at night? Is it complicated with other factors? It could be high blood pressure, migraines, and arthritis or whatever. And I've seen with some patients that just having one treatment a month seems to just keep them at bay and keeps them a little bit de-stressed. But ideally, what I try to do is try to see people like a couple of times a week for a few weeks, just sort of to get on top of all their different energy imbalances and get to learn a bit about how their body responds to acupuncture. And then I try to keep them on a bit of maybe a maintenance program. What about you, Carolyn? How do you tackle the treatment of menopause and heat flushes with acupuncture?
Well, it's interesting. Like you, it depends how severe the symptoms are, what they were like before, how many other things have they had going on? Were they hot people, cold people anyway? People who are hot anyway are going to get worse hot flushes, no doubt. So I do the same as you. What I do, interestingly in this country, because people aren't used to paying for health, there's a real resistance to paying. They're not used to investing in their health, which is a problem. So what I try and say is, can you come weekly 4 times? And my rule is if they don't notice anything after 4 times, I won't keep them coming back. But usually there's some shift, and as then you say, perhaps spread it out a little bit. And it seems to last as well. After those initial 4 treatments, the treatment seems to last a bit longer, doesn't it?
Is there anything else that you could tell us about addressing heat flashes during menopause, and and what you could recommend, stress reduction or diet or whatever. Have you got any some self-help things for the listeners?
Yeah, I think there's several things. There's been quite a lot of study on actually getting the levels of adrenaline down, getting the stress hormones down. So anything that anybody can learn to do, like deep, slow abdominal breathing, meditation, qigong, so qigong, tai chi, those sort of things that just really settle the nervous system. I also think if you look at other cultures, this is a rite of passage for women, and we're sort of medicalizing it as well. So I'm really encouraging women to use it as an invitation to really look inside. There's some real assertion and energy that comes with the menopause that might upset the people around them, but actually it's an important, these funny expressions like the crone, the elder, the hag. This is an important chapter, and I think we need to be really looking at it in a very different way.
All right, okay. But listen, thanks, Carolyn, for coming onto the show, and we look forward to the next show, and at the next show we're going to be talking about actually sort of night sweats and chills and menopause and acupuncture.
Okay, well that'll be interesting because as you know, a lot of people know about the sweat, but not so much the chill. So that'll be interesting. And thank you very much for having me on the show.
Okay, and I look forward to our next show. Goodbye, everybody.
This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.